This is a short video on the interrelationship between fire and water, and therefore heart and kidneys. These two polarities represent the yin and the yang, fire being the yang and water being the yin. And in the five-element arrangement of the Shen cycle, water would overcome fire. But there is another arrangement of the five elements in a cross-like fashion, in which fire is at the top and water is at the bottom. And there is a mutual communication and indeed nourishment between fire and water. Water does not extinguish fire, and fire does not dry up water. They communicate with each other and they nourish each other. And indeed, in terms of heart and kidneys, heart yang descends to the kidneys, and kidney yin ascends to the heart to nourish it and cool it. The second aspect of the kidney and heart relationship is that they are the root of Shen and Jing. And of course, there is a mutual communication between Shen and Jing. Shen could be seen as a refined, or the most refined type of qi, and a refined type of Jing. And Jing is the foundation of Shen, and Shen directs the Jing. The third aspect of the kidney and heart communication is within the menstrual cycle. Kidney yin is the origin of Tiangui, and the menstrual cycle is an alternation of yin and yang of Tiangui. And kidney yin is the origin of Tiangui, but it needs the descent of heart yang to the uterus in order to promote menstruation and to promote ovulation. And the fourth aspect of the relationship between heart and kidneys is in the sexual physiology. Kidneys, of course, are the origin of sperm, and many types of sexual dysfunctions are due indeed to a kidney deficiency. However, they may also be due to a heart deficiency, because heart qi and heart blood descend to the genitals to communicate with the kidneys. For example, some cases of erectile dysfunctions could be caused by heart qi not descending to the penis rather than by a kidney deficiency. But there is another very important aspect of the relationship between heart and kidneys, and that is in the mental emotional sphere. The heart houses Shen, and the kidneys houses the Je. We will see in a moment what the Je is. I would say that the Shen and Je together correspond to what in Western psychology we call the self with a capital S. And that is why I hesitate translating Shen as spirit, because what we call spirit would include the Shen of the heart, but also, very importantly, the Je of the kidneys, and also the Hun of the liver. The word Je has many simultaneous meanings in Chinese. It can mean willpower, and indeed I translate it as willpower, although I do not claim that to be the only correct translation of Je by any means. It can mean willpower, also includes memory, determination, drive, motivation, enthusiasm, and focus. These qualities are reflected in the Su Wen statement that the kidneys are the official with great power, which is essential for the kidneys to give that power to the Shen. The communication between heart and kidneys is highlighted by analysis of the Chinese character for Je, which is composed of the heart below, the character for heart below, and the character for She above. And She is, can be a scholar, an official, an officer of an army. So this symbolizes the strength of character that the Je of the kidneys gives to the Shen of the heart. So, having discussed the communication between heart and kidneys, I'd like to say a few words about the points I use. Chinese books do talk about establishing or promoting the communication between heart and kidneys, and the points every book usually recommends are bladder 15, which is the heart back shoe point, and bladder 23, the kidney back shoe point. I don't use that combination, mostly because they are backshoe points, so they are young in nature. And I prefer much more to use 2 points on the Ren channel. I Ren 15 for the heart and Ren 4 for the kidneys. And I find these 2 points the best, the most effective for promoting that connection between heart and kidneys. But there are 3 other situations that occur when promoting the communication between heart and kidneys, and that's to do with the extraordinary vessels. The 3 extraordinary vessels, Du Mei, Ren Mei, and Chung Mei, they all promote the connection between heart and kidneys because all 3 of them arise from the kidneys and all 3 of them flow to the heart. So they're an excellent way of promoting that communication between heart and kidneys. And of course, I would use the Du Mei in the cases of kidney yang deficiency, and I would use small intestine 3 and bladder 62 to open the Du Mei, plus Ren 15 and Ren 4. And that, by the way, would also be a very nice combination of Du points and Ren points, i.e. yang and yin. I would use the Ren Mei in cases of kidney yin deficiency, and that would be lung 7 and kidney 6 to open the Ren Mei, plus Ren 15 and Ren 4. And finally, I would use the Chung Mei for blood stasis, with spleen 4 and pericardium 6 to open the Chung Mei, plus Ren 15 and Ren 4. So in conclusion, my favorite points for promoting the communication between heart and kidneys are Ren 15 and Ren 4.